Hi, I'm Dr. Twasim and welcome to my derm classes. Today's lecture is on part 2 of hair shaft disorders, which is basically about hair shaft disorders without hair fragility. This is not a very long lecture as the number of hair shaft disorders are less. As discussed before, we'll be first going through the clinical scenario and from there we can go for the microscopic image. In scenarios where the clinical image is not relevant, I'm directly going for the microscopic images. So let's get started. So, a girl child is brought to you with complaints of diffuse hair loss by her parents. They also complain that her hair doesn't grow long enough for a haircut. So, let's try a hair pull test first. So, that seems to be positive in this case. So, let's take that hair for a microscopic examination. So, this is the microscopic image. So, I want you all to pause for a moment and look at the image very closely and compare it with a normal hair shaft. So, as you can see in this image, you can see that there is some longitudinal grooves along the hair shaft as well as the cuticles look very shuffled. So, this is what we famously call as floppy sock appearance. Along with that, you can see that the hairs are in the anagen phase. So, this basically because of the hockey stick appearance. As you know, what's the basics for a telogen and the anagen hair under a microscope. So, this is nothing but what we call as loose anagen hair syndrome. And one of the differentials for this is alopecia areata. Again, it can be patchy or diffuse hair loss, but a dermoscopic examination might show you black dots and white dots. And as well as the hair shaft in an alopecia areata will be normal. So, these are the main differentiating features. When it comes to the treatment, generally loose anagen hair syndrome improves with age. So you can advise parents to do a soft hair grooming practice. Along with that, if doesn't improve, biotin have been seen to be effective in a couple of cases. So that is something that you can try. So let's go for the next. So let's go for the next clinical picture. So this is basically a microscopic image. I want you to pause for a moment and take a closer look. The clinical image in this particular scenario is not very relevant. So what you can see here is that there is an alternate light and dark bands. So why is there is light bands here? So it's basically because of the reflected light because of air bubbles in the hair cortex. Something that's similar that we have learned before in hair shaft disorders part 1 is trichothiodystrophy. But there, as you know, the alternate light and dark bands are basically because of the broken hair shaft because of the sulfur defect. So you need to know what is causing the clinical image that you're seeing, the microscopic image that you're seeing. So, and in this case, because of the hair bubbles in the hair cortex, the hair might be occasionally fragile as well. But the prognosis of this case is that it generally doesn't worsen with age. So this is what we call as polyannulati. And the name here is basically because of the annular nature that it has. Let's go for the next clinical scenario. Again, I want you to pause and look at the clinical image again. So this is a microscopic image. And as you can see here, the hair shaft basically splits and then it again fuses. And there is also a knot of hair that's present in the clinical image. So this is what we call as bifurcati because the hair shaft is splitting, but then it's fusing back again. So this basically doesn't present with a clinical symptom and very rarely presents with a hair loss. So this is just an occasional diagnosis that comes out while examining the hair shaft. So let's go for the next clinical scenario. A young boy is brought to you with a very coarse, dry, frizzy hair, which is very difficult to comb. This is a very striking appearance. Some of you might have already diagnosed it. So let's go for the microscopic appearance of the hair shaft. So again, I want you to pause for a moment and take a closer look. In this case, what you can see is that there is a longitudinal groove along the hair shaft. In this case, an electron microscopy will also help. So let's take a look at the image. You can see that it's triangular in cross section as well. So this is nothing but uncombable hair syndrome. Now, why is there a longitudinal groove along the hair shaft? It's because of defective keratinization of the inner root sheath, which makes difficult for the hair to grow out, which actually creates a groove in the hair shaft. Coming to the treatment, it generally improves with time. In some cases, biotin can also help. Let's go for the next case. So let's go for the next clinical scenario. Here you can see that the patient is presented to you with wavy and coarse frizzy hair. So the microscopy the image is not included in this slide, which basically shows axial twists, some broken hairs, as well as grooves. So this is what we famously call as woolly hair. It can either be generalized or it can occur as a patch, as seen in this image, which is called as woolly nevus. But the important factor about woolly hair is that you need to see if the patient has associated cardiomyopathy or palmoplantar keratoderma. Why? Because then you need to diagnose with Naxos syndrome or Kajawal syndrome. So let's go for the next clinical image here. So in this particular scenario, imagine the patient presents to you with inflammatory nodules in scalp and beard areas. So it's generally more seen in the beard area. And the dermoscopic image shows the following image. So you can pause for a moment and have a look at it. Here you can see that from one particular hair follicle, multiple hair shafts have been coming out. So this is what we call as pili multigemini. So in this case, what happens is that these hairs have different inner root sheath, but they all have one single outer root sheath, which is why they appear as they're sprouting out of a single unit. So generally what happens is that this can produce inflammatory reactions in the skin, which is why they present with inflammatory nodules. And this is basically because of a couple of genetic problems, genetic mutations that's associated with following genes that's being depicted in the slide. So let's go for the next and the last disorder. So let's have a look at the clinical image. So you can see that the patient has a normal hair on the top, and on the sides you can see it's a bit frizzy, a bit curly hair. So this is nothing but acquired kinking of the hair. So this generally occurs in young men and in generally the vertex and the frontotemporal region. So this is being identified as an early stage in androgenetic alopecia, or this can be acquired in cases of, again, improper grooming of the hair with hair straighteners, grooming, or chemicals that's been applied. So generally, thinning is not sometimes seen, which differentiates from the androgenetic alopecia. So the treatment is that you need to modify the grooming practices. In some cases, it can be congenital. In that case, there is no particular treatment that we can give. So that finishes off our hair shaft disorders part 2. So these are my references, and I have obtained the clinical images from some of the articles as well. So that finishes off the lecture. Thank you so much for listening. Let me know if you have any doubts. I hope this helped.